bad shape to being able to get up and walk. And then I'm going to tell you a little bit of the science, not a lot because it's late in the day and it can get really technical, but to sort of give you an idea of what's happening in your animal when they have stem cell therapy. And then Dr. Liar is going to talk about what kinds of conditions we can help with this. And then he and I both kind of talk about if your animal comes in for stem cell therapy, what can you expect as the pet owner and what happens to your animal when they come in. And then I'm going to show you 3 clips of other animals that have had stem cell therapy. There's about 300 clinics on the mainland that are doing this. One of the clinics is in Florida, and they've done a nice job putting together 3 videos of before and after cases, so I'll show you those, and then we'll have questions. But of course, feel free to ask questions at any point in time. So stick the pointer on the middle of the screen. So this is a 10-year-old lab, and I like this clip because it's pretty, just click again, there you go. Pretty quick. So what you notice here is watch how hard it is for him to get up. And you see there's definitely some atrophy. And then also watch how hard it is to get him to step up on that scale. And you actually see the person kind of pulling at the collar to get them up, because it's just having a hard time with his hips. So remember how hard that was. So then Harley had stem cell therapy. And the next clip you'll see is 3 weeks later. So atrophy that the dog's getting up quickly, but watch how quickly he gets up on the scale. So that's just 3 weeks later. You see he shaved so they could make it clean for the injection, and on the shoulders where you remove the fat from the animals. That's why you see that patch. Here's 4 weeks later, and it's no problem at all for the dog to get up on the scale. So that's what we see in over 95% of the animals that we treat. We treat them with stem cells and we see an impact. This one is, like I say, particularly remarkable because the dog was in such bad shape earlier. But the question is, okay, what's happening? What exactly happened? Oh, actually, hit escape. And then stick the pointer out. Yeah, there you go. Now you should be good. So we're talking about a little science. I hit forward again. So basically, does anyone here know about stem cells? Yeah? Excellent. A little bit? Okay. When I talk to people, people know everything from absolutely nothing to a whole lot. So this is the basic thing about a stem cell. There's 2 really unique features, and they're both in the same cell. So a stem cell can become another stem cell. It can regenerate itself. That's not so remarkable, but the other thing it can do is become a different kind of cell. So a stem cell can become a heart cell. Stem cell can become skin. Stem cell can turn into eye cells, hair follicles, spleen cell. So you start to think about, well, that's pretty powerful if you can use these stem cells to repair a problem in your body. So next slide. So as you can imagine, there's tons of human research ongoing right now. Most of the big pharmaceutical companies are looking at different things. There's some great studies going on in hearing restoration, sight restoration, great studies on burn victims where they're regrowing new skin from stem cells. So there's about 2,000 clinical trials going on right now on humans in stem cells. So it's just booming. Forward again. And we are starting to see it in the news. Oh wait, we lost one. I think we missed a slide. Oh, maybe it's not in there. So the 2 things, I'll just tell you. 2 things that came out this year. In May of this year, the very first human stem cell therapy was approved to be used on people. Because here's stem cells, is this really happening? It is happening. So a company called Osiris up in Canada has a stem cell therapy it got approved for children in graft versus host. It's for bone marrow transplant cases. 80% of those kids don't do very well. And the only treatment for it right now is steroids. And steroids help like 30 to 50% of those kids, and the rest are dying. So stem cells are now being used, and it's helping. They showed that they can help 64% of these kids, and they get better. So stem cells is starting to make its way on the human side, and in October, Nobel Peace Prize was awarded to stem cell scientists. So it is coming. And so what happened on the animal side, some very smart animal doctors said, oh, look at what they're doing on the human side. Can we take what they know for humans and right now start helping animals? And the answer is yes. And so that's what we're doing. So Dr. Liara, if you want to come and talk a little bit about the conditions. Do you want to answer?
So in animals, the vast majority of stem cell has been used to treat osteoarthritis. Australian Shepherd's Labs, a lot of large breed dogs are very prone to arthritis, hips, elbows, knees, ACL tears, things like that. So what was over 5,000 dogs Medivet has treated for arthritis.
Dogs and horses and cats, and we've even done a bird.
Yeah. So there is a lot of background behind arthritis. There are also other cases that we're just getting into right now. There have been a few cases in cats. Some cats get really severe gingivitis and stomatitis, and there's been some really good results with treating that. We're going to do our first one here probably in the next month. It's been used to treat chronic kidney disease, allergies, autoimmune disease, IMHA, which is a disease of the immune system. Stem cells help regulate the immune system. If you have an overactive immune system, it can help calm it down. If you have a weak immune system, they can help boost it up. So, there is preliminary treatment being done with immune-mediated disease.
That's great. So we know a lot about the arthritis and like the partial tears, cruciate injuries. We know that we can help greater than 95% of those animals. So these are compassionate use cases where we're gathering a lot of data and we're seeing some encouraging results, but we haven't treated enough cases to be able to say, this is how we do it, and this is the success rate. So if you have an animal that falls under any of these categories, just come in and chat with the vet, and then we can find out. We're all sort of linked. All the vets that are using this are all linked, and so it's easy to get information about who has treated this type of condition and how did you treat that and what was the outcome, and so lots of information.
There are several doctors on the mainland that I've talked to who have treated the gingivitis cases in cats, and we have resources on the mainland that I can get through Carol to talk about different diseases to see kind of what protocol they use regarding the injections and things like that.
So the one thing we don't treat is an animal with cancer. Also, if they have an overt infection, we really want that to be cleared up first because that's going to have their immune system just not functioning properly. In a case of cancer, there's lots of research going on in this on the human side, and we just don't know enough. In some cases, it can make a cancer worse. In some cases, it doesn't. So the last thing we want to do is put an animal at risk. So if it has cancer, we won't treat it. Okay, so what to expect if you want to have stem cell therapy. So I'll start this off and then I'll let Dr. Liara talk about it. So one of the big benefits to Medivet is so the first company that started doing this in 2005, and they're still going, requires you to ship your fat. So you take fat out of the animal and then you process that to get the stem cells. It required you to take the fat and ship it to the mainland. And that works pretty well. That was sort of state of the art then, and as technology advances, our company came along with a way to do it right in the vet's clinic. So a huge advancement. I like this picture because everyone here gets it that we're out in the middle of nowhere. So having to rely on shipping something for a significant part of your medicine is really ideal. So there's no shipping costs. I know I've had things not make it in the mail. I've had things that were supposed to come to me cold and they come hot. Because what I learned is those little ice packs, when they heat up, they actually retain the heat and they really cook your sample. So big benefit, the sample doesn't leave the clinic, and it can all be done in one day. Your animal comes in the morning, the fat's harvested, cells are processed, they get injected, and the animal goes home. It's completely safe, and this is Jody, who is an integral part of the stem cell team. She is the vet tech here that actually does the processing. So I have over 20 years experience in healthcare on the human side, and so a big part of my job is making sure that clinics are trained to do it exactly right. And Jody was a phenomenal student, and she does a really good job. So I'll let you kind of talk about more the mechanics of what happens? You can advance it.
So basically, the day of the procedure, it's like any anesthetic procedure. They will need to go under anesthesia to harvest the fat. We harvest fat from the falciform ligament. It's called a ligament, but it's actually fat. It's just inside the abdomen, just behind the ribs. We make a small incision on the belly. We take the fat from there. Most animals have plenty of fat to harvest from that area to provide the amount of stem cells that we need. So there will be a small incision. The total anesthesia time is maybe 15 to 20 minutes from prep to close. So it is a very short procedure. And then the harvesting of the stem cells from the fat takes 3 to 3.5 hours. During that time, the dog usually is fully recovered from anesthesia. They might still be a little bit groggy. A fair number of the animals, we can then inject the necessary joints that same day without any additional sedation. Some of the animals, my own dog, I did have to resedate because he's kind of a wimp. So it all depends on the dog. But they will go home that same day. Are you going to talk about banking later?
Yeah. So,
Okay.
we're going to talk to him about.
Oh yeah, along with, we will inject the particular joints that are affected. If it's the hip joints, we'll inject the hips. And this is all done preliminarily. We'll take x-rays or look at x-rays that have already been done to determine which joints need to be injected. And we do also give one injection IV. The IV injection goes throughout the body and it's going to hit areas that we have not seen on x-rays or areas that we may not know are problem areas at the time.
That's part of how we know, you said that long list of compassionate use. Part of how we've started building that out is dogs or cats that are horses or animals that have come in and have been treated for arthritis. The owner comes back and they say, wow, they're walking and getting up, their joints are so much better and the skin condition cleared up. Or they had a case here where a floppy ear stood up again. Yeah. So there's a lot of human research. The reason we do IB is based on a lot of human research that says stem cells have this uncanny ability to find areas of damage. So it absolutely can't hurt, and you may pick up an added benefit by doing the IB.
But we won't have any ears growing out of their backs.
No, it'll only replenish what was there originally. Yeah, they're phenomenal cells. I mean, I knew about this and I'd heard the stories, but then when you actually see it happen in dogs, Dr. Tedder did his first case and he's seeing the results now. And the owners are happy and it's such a simple, really it's very simple. You're taking fat out, you're extracting cells, and then you're putting them back in the animal. That's simple, right? No drugs, no medicine, there's no risk. Their own body, it can't hurt them. They are under anesthetic for a short amount of time. That's the biggest risk. But you'll see some more videos, but when you actually see it with your own eyes, it's like, wow. Everything else.
Is intention a word I haven't come across before, or just a typo?
Oh, injection. Yeah, injection. It's a J instead of a T. Sorry about that. Good catch.
After the procedure, we usually keep them quiet for about 10 days. That's the amount of time it usually takes the incision to heal also. So they'll come back after 10 days, we'll take the stitches out at that time. We can start gradually returning them to normal exercise. Start with short leash walks, gradually increasing. Typically, we'll start to see the best results around 3 weeks. So usually we'll go out as long as 60 days. If we have not seen the results that we maybe like to see within 60 days, then we can consider giving another injection. And we'll talk about that in a little bit when we talk about banking cells.
So, thank you. So the initial treatment on all the animals that we've treated, typically what we're seeing, it lasts an average of 1 to 3 years. And it really depends on the age of the dog, the condition that they started with. And it's also a situation where if this is where your dog is, and this is perfect, right? This is like the perfect dog, you'll see some improvement. And if you want this, right, let's say you get to here, then after 60 days you might say, hey, we came that far, let's see if we can get a little bit more out of it. So but typically, the initial treatment will go for like 1 to 3 years. Now, we can bank cells. We have this cryobank in Kentucky. And what we recommend this for either severe cases or young animals, because once so you do the surgery, Jody prepares the cells, and then you ship the extra back to Kentucky, and then if 6 months later you say, I think I want to see a little more, or 2 years later you're starting to see a lymph again, or they're starting to lay down a little more, you could just call Dr. Riera and say, I think it's time for another injection. They'll ship the cells out here, and then you bring your animal in, they do a joint injection, and they go home. So they don't have to go through the surgery. So it's a really nice, really nice option to have. So we also look for compassionate use. Those are the cases, like the feline gingivitis, the cases that we don't have a set protocol for. And on those, we typically do quite a few dosing in the beginning just because it can't hurt and we don't really know what the exact protocol is. Another thing that's nice to do, if you have an animal that's a breed that's prone to issues, or if like the parents had the same issues, you can actually remove the fat tissue during another procedure. So if they're having anesthetic for a dental or a spay neuter, or if they're in for anything else, you can just say, hey, at the same time, just go ahead and take out the fat, and then you don't have to put your animal through another procedure. Another benefit to taking the fat out when they're young, like at a spay neuter, is younger dogs can tolerate surgery better, and young dogs have more stem cells. And it's just like as we look at ourselves, when we were a young child, if you rolled your ankle, you got bitter quick. Now, you roll your ankle, it takes a little more time, just because our bodies, as we age, we have fewer stem cells in them. So this is actually really popular. So there's quite a few people that do, clinics that do routinely offer this as a service to take the fat removal when they do spay neuter. So a really nice option to have. Okay, so if you want to ask a few questions while I set up the videos.
So one question I have is banking it versus just doing the whole thing all over again cost difference? I mean,
It's significantly less.
bank it?
Yeah, when we initially do the procedure, there's a kit that we use to process the stem cells out of the fat. Depending on how many injections you think you may need, we determine are we going to give a small kit or a large kit. The small kit runs about $700. The large kit runs around $1,100. So when you look at the cost of the whole procedure, you do not need the kit if you're just doing an injection from banking.
My question would be like for Hannah, who's got the dislocated hips or dysplasia or whatever it is. Would doing this be something to do instead of surgery down the line, or might it delay surgery down the line, or would you do both of them anyway?
I think the goal would, you could have one of two goals. Ideally, you could maybe do surgery and stem cell together. I think for her in particular, she's got such bad hip dysplasia, her hips are actually subluxating out of the joint. That is not going to correct with stem cell therapy alone. The stem cell therapy, if that's all we did, would be aimed at helping control the arthritis and control the pain associated with the arthritis. If you can also do a surgical procedure at the same time to help prevent the arthritis from progressing, that would be beneficial too. I doubt they've done has anybody done total hip replacement with stem cells at the same time? Probably not. Total hip replacement is a very, very strict, sterile procedure. You really have to follow certain protocols. They don't let anybody leave the room and come back in at all when they're doing total hip surgery. So
They did a case where there was a dog that needed both hips done, but the owners had, I guess you can't do them at the same time, right?
yeah.
So what they decided that the dog was in so much pain, they replaced one side and did stem cells on the other side, just to help them feel better. And it turns out, and I don't know what the exact problem was, it really depends on what the exact problem was. What it turned out was that they ended up not doing the replacement on the other side. But also you had more stability on the other side, right? So there's quite a few vets that are doing tandem. They'll do the surgery and they'll do the stem cells because the outcomes are just so much better. One of the other things in the sample, the cell sample that we take out of the dog, it's not just 100% stem cells. It also has a bunch of other helper cells in there. that make the stem cells really work. There's also very potent anti-inflammatories. There's growth factors. There's just a whole soup full of really important healing molecules in there. And so often what happens, you know that the stem cells in a dog take about 3 weeks to really start to do their work. Sometimes owners will report, oh, they were better like the next day. And a lot of that is due to these anti-inflammatories that are being injected. And so for healing, that's another thing after surgery, when you're just loading up all the body's natural healers concentrated in that one area, really helps them heal faster. Because then you've got the stem cells going in and laying down fresh cartilage. And there is evidence that they do lay down fresh cartilage. So you end up with just really, really good outcome when you do the two.
I was going to ask how you kind of program the stem cells to do one thing or another, but it sounds like they're figuring that out for themselves. What about, but you're talking mostly about young animals here. My old cat is arthritic and has some degree of kidney failure. She probably is not a great candidate for anesthesia.
Yeah, the first thing is to determine, can they handle anesthesia? You know, just because she's in kidney failure does not mean we can't do anesthesia. It would depend on the degree of kidney failure. We take certain precautions. Sometimes we diurese them for 24 hours with fluids before we anesthetize them. I think, I don't know what the percentage is, but I would say the majority of animals that are receiving stem cells are probably older and geriatric. That's where we see a lot more of these problems, especially like arthritis. So we did a dog, the second or third dog we did was a lab mix who was 13 or 14 years old. So a lot of these patients are very elderly.
I've got a younger one, and they had gingivitis too.
Yeah.
How do you treat that? Do you actually inject it into the gums, or do you?
There's not a set protocol for that at this time.
Let the find
Yeah,
gingivitis?
one doctor I talked to just gives one IV injection. Another doctor I talked to gives the IV injection plus puts a little bit in each quadrant where they have gingivitis just under the gum. So, you know, I think with time, you know, a year, 2, 3 years from now, there may be a set protocol on really what we should do when we've gathered more information.
Does VPI cover this at all?
We did one dog that had VPI insurance, and they considered it a surgical procedure because we are doing surgery to remove the fat, and they covered out of the entire procedure, I believe, about $1,500.
Trying to get some of the money back out of the unions or something.
Exactly, take advantage of that. Great.
On banking the stem cells, do they ever run out? Or do they regrow it in the lab?
You could. You know, if you have a dog that needs 6 or 7 injections because they have so many problems in so many different areas, and you collect as much fat and you get as many stem cells as you can out of that, but maybe you only are able to bank
I see.
4 or 5 or 6 more
Oh, so
injections. You may be able to inject that dog
So
one
it's
more time,
not,
but
it's
not
not
twice.
grown in the lab, then you can't
Right,
transplant it.
no. They take what we send them and just freeze it.
And we get, our cell yields are pretty good. Typically, if we're using a large kit, we're getting like 10 to 12 vials. So, and this is all based on the human research, because we bank cord blood from babies, right? And so these are good for like 100 years.
So
So
the banking has like a monthly fee or something?
it's $150 a year.
Wow.
And so that's straight with that doesn't go through the vet, it's just between the pet owner and the bank in Kentucky. So that's
How long is it good for?
I like to say about 100 years, yeah.
Forever.
It's based
Longer than
on,
the dog, yeah.
it's based on human technology, right, where they
Clone the
take
dog, right?
cord blood from human babies, yeah. So it's, yeah. That's nice.
Now, is there, you know, you were saying earlier that because this is from the dog to the dog, or from the animal to the animal, that there's not problems about, you know, the graft versus host or reactions or something. But if you can save a sample for obviously longer than the life of any animal, it's up to 100 years. Is there any sense that you would be able to bring it back into some other animal at a later date?
We don't. It's so simple to see.
Yes, I
Like she still walks the same way, but I don't know if that's just from, muscle memory and, but for the most part, she's got her back legs again. She never had them. I think when I got her around 4 months old, that's the last time she had them. She tried to jump from the ledge, probably about that high. When she jumped down from there, that's when she dislocated, and that's when we figured out when we took her that she had the bad hips. But yeah, she gets up, a lot quicker. She doesn't have that beat up feeling anymore, where she's trying to get up and she gets up slow. I can sense she's got something like in the front, because I can tell she favors a little bit. But for the most part, the back legs are very, very nice. She puts pressure on them. When I pet her on her backside, I can feel her strength. Before, when I did that, her butt would go down. Male dogs, when they get on her, try to get on the back of the bed, she goes straight down. I think now she's got a lot more strength back there. I heard any crackling or popping. I've got the ball on the street right now. Just come around and throw it. She was chasing after it. I can see her back legs pushing off the ground, which is good. And she keeps wanting more. I live in her, I don't want her too much. Yeah, so. But she always keeps wanting more, no matter how, I felt like 3 or 4 times and she comes back wanting more.
Yeah. She says she feels a lot better than okay, good.
Oh, yeah.
All right, so
That's one of the things that we hear a lot is that the animals, they mentally seem clearer and they seem younger mentally. And I think a lot of it is one of the, this is really good at taking away pain. And I think a lot of it is if you have an animal who's in chronic pain and then you take that pain away, they're gonna feel better and seem younger. So here's another story.
For the last couple of days, I've always told you that I didn't think it was working.
yeah.
And just the last couple of days, I don't notice her when she's out in the yard, all of a sudden stop and then standing there like, ow, ow. She's not doing that out. Even when she gets up in the morning, as she gets off the bed and walks down, because I have stairs to get up on the bed, she doesn't, at the end of the stairs, she doesn't sit there and go. And I'm like, I used to get worried, like, come on, this is my last dog, I don't need this problem. And now I don't feel like I'm
Okay, I'll show you one more. This is a small dog, and this is more of the dramatic story. The nice thing is with this is we get enough cells, or if they have problems in hips, knees, and ankles, we can just inject everywhere. If they have, some of the spine issues. You can actually kind of hear her crying a little bit. It's a little hard to watch.
Oh, good, yeah, that's good.
So what's the most thing that she has trouble with?
Just walking, just go out, go to the bathroom.
Check the value out
I
there.
have to carry her, I have to hold her.
Does she have any stairs that she has to go up and down?
Just wanting to get up into the house, it's just
Just
that
as
she
long as
can't even get up that. I have to help her up that, help her down it. I don't want her in pain, so it's like everything she needs to do, I do it for her.
Årligen sen förra året specifikt.
I have to take her, I have to carry her to a food bowl. I have to carry her down the step because I'm afraid it hurts her. And then to get back into the house to the cage, I have to take her up the step. To go to the bathroom, I have to walk her out to the yard because just looks like she's in so much pain that she can't even go to the bathroom. And then I have to hold her until she has to,
Like today,
she gets out of her cage, she walks out by herself, I don't have to pick her up. I automatically grab her and start doing it for her because I'm so used to doing it. Well, maybe I'm not supposed, shouldn't be doing that. Let her do it herself. She's doing very well. She's doing real good. She's getting outside, she's walking in the grass, being able to walk with the dogs. I'm supposed to that good business, and I don't have to carry her out.
Absolutely, she's a cool dog.
Even something as simple as laying in her crate, barking. Before she wasn't even barking. She was just laying there. She was just sad. And I didn't want her to have to live like that. And you don't understand when the dogs are hurting. You don't understand what it is or what's going on. And, the other dogs are excited. They're barking. The doorbell's going off, and she's just laying there. Yeah. But now she gets up and she barks with the other dogs, and that's her protecting thing. All the paperwork has been transferred over to here, but I'm gonna double check on that because I want my dogs to come here rather than where they've been going.
So those are some stories of real cases, and like I say, for the arthritis cases, we see improvement in like 95%, greater than 95% of the animals. So questions also, Jody is the one who, so what happens is Dr. Liera, or actually Dr. Tedder, Dr. Kunamoto removes a little bit of fat. It's about 2 to 4 tablespoons of fat, so it's not that much. And then it gets handed off to Jody. And then she masterfully works the sample up over the next 3.5 hours. So any other questions?
Is there any reason why the results only last 1 to 3 years?
Some of them last forever. We don't know. Some of that has to do with what we're doing, like in the case of arthritis, we're laying down new cartilage, but we're not repairing the problem that caused that. So if they have a degenerative disease, that's still going to be there. So in a lot of these cases, we'll put down new cartilage, and then that degenerative disease is going to continue. So when it gets to the point, when the cartilage has disappeared enough to cause the pain, then lay down new cartilage.
Will it make them smarter?
Generate brain cells.
Well, I don't know. If you hear some of these stories, talking to pet owners, some of them just think it really increases their mental acuity. So I think I could find some pet owners that would tell you they thought their dog was smarter. But I think
Dogs are more active.
Yeah, they're more active and they're more alive, right?
They're not in pain as much.
They're not in pain, because I know me, I think all of us here, when we were in pain, that's all you focus on, right? And it really clouds you from being able to think and live normally. So I kind of think it's more that versus stem cells making them smarter, but I don't know. I don't know. It can't hurt them, that's for sure.
the brain in there now.
So what is the average total cost?
It depends on the number of injections and the size kit that we need. Depends on if someone comes from another clinic, they may have already run blood work and taken all the x-rays that we need. If we're starting from the beginning and we have to do everything, bring a set of blood work, x-rays, typically you're looking in the range of $2,100 for us, $2,100 to $2,300 maybe for a small kit, and then upwards of maybe around $2,800 to $3,000 for a large kit to get more cells.
I had a question about the insurance, and people have asked me, is it like the human insurance where it's a pre-existing cause? So if they've been diagnosed with like feline gingivitis, can you then go get insurance and wait the waiting time? And
I think every insurance company is different.
You have to check
I think
with
some
them.
have clauses regarding pre-existing conditions. Some insurance companies get medical records for just 2 years. So if the records for the past 2 years mention nothing of gingivitis, then they're considered free of that disease. So it's going to be totally dependent on the particular
can
insurance
you
company.
check with them?
DPI is one of the better insurance companies, but they do they have exclusions in there. I mean, I had a cat that only had 3 legs, and they put in an exclusion for his 4th leg. So excuse me, guys, he doesn't have one.
Just in case you found it in one of the
Any questions?
So I have a little.
And we will do free evaluations. You know, you can bring in Chevy.
Oh, this is Tucker.
Oh, that's Tucker. He looks like Chevy. Sorry.
When he's standing with his tail to you, you can tell the difference.
Yeah, we'll do free evaluation. You know, if you have records, X-rays from another vet, you know, we'll look at those X-rays and determine what all we need.
So can you do it now, or is that?
Probably better to schedule separately. Yeah, so we can do a full exam and look at any records, X-rays, things like that. Yeah, I know the email blast that sent out said bring your pet for a free exam, and I saw that after it was sent out.
My fault.
Probably just schedule it separately. It would be better. We'll have more time. And,
See, I thought it was just like sort of one of those like mini kind of things, like when you go to the health fair and the chiropractor is there, kind of thing that you
Your
would
heel.
as a model to show what you'd be looking kind of for, not an actual person.
A canine gingivitis, you gotta really.
I don't think so. I mean, feline gingivitis gets so bad that they stop eating. They hypersalivate. It gets really, really severe. We believe it's an immune-mediated reaction to the things that are going on with the root of the tooth. So until now, the only treatment was full mouth extractions. This maybe offers another option rather than something that dramatic. Dogs, gingivitis is typically due to dental disease. So if you do routine cleanings, keep the teeth clean, keep the tartar buildup off, they shouldn't have really bad gingivitis like cats will. Because I've seen cats that have virtually no tartar that have severe gingivitis and stomatitis.
That's no issue. He
Yeah,
has no tartar, but.
it has some
I mean, yeah,
gingivitis.
he has.
Do you know of any dogs that have been done?
I don't, but I've never asked the question. I mean, the nice thing about the feline gingivitis is your option is pulling the teeth, but we don't know if that's gonna really work. And so doing the stem cells will not hurt the cat. And there's one vet, I think it's Dr. Snyder, who basically says that's his gold standard for all his feline gingivitis cases because he's seen some really good results. So, you know, much better to try that before you pull all the teeth, because once you pull the teeth, you can't go back. They're gone.
And my cat has feline gingivitis, and I've been researching this for 6 months, and we're going to do it next month. He got diagnosed 2 years ago. He had all his teeth pulled, or 3 of the teeth pulled, and it didn't help. And so we have to do steroid shots every month to keep him alive, or he screams in pain and won't eat. Dr. Lara saw him, and so we're going to do it next month. But he's getting worse after 2 years of getting, and the steroid shots are not good for him. So this is our next hope, because I don't want to take the rest of the teeth out.
And I should have invited introduced Laura Chapman. She is the face of Hawaii Wellness Directory, which is right there. So she knows a lot about all the health and interesting medical things going on in the state of Hawaii.
And I met Carol at the Pet Expo this summer, and I just thought this was such an amazing hope for me, especially to start with, that, you know, my cat is not going to make it much longer having to do the steroid shots. So either we put him to sleep or we wait for that to damage his liver. So I'm really excited that, you know, he's only 9 years old, that, you know, this is a good chance and we have some hope. So I'm excited. We're going to have an article in the next magazine, and hopefully, you know, more pet owners will be able to find this. And I actually want to come to this clinic and support Dr. Lara, because he supports, you know, this alternative complementary service. Everybody's quiet tonight.
Well, feel free to get some food. You can informally talk with any of us if you have more questions. And thank you very much for coming.
Thank you for coming.
Thank you.
Schedule some time to have a feel free evaluation.